My name is Anissa Tamayo. Right now I'm going to talk about epidemiology of human infections with avian influenza A H7N9 virus in China. Definition: most human infections with avian influenza viruses, including H7N9 virus of Asian origin, have occurred from exposure to infect poultry or contaminated environment. H7N9 virus of Asian origin continue to circulate in poultry in China. Most of the patients with H7N9 virus infections have several respiratory illnesses. There were few cases of limited person-to-person spread of this virus in China, but there is no evidence to show sustained human-to-human.
It isn't entirely known how this is transmitted, and it is thought that it probably has a poultry connection, but there are at least 4 cases in a family cluster where it's thought that the transmission of it was human to human. And that is terrifically significant because influenza doesn't become an epidemic or globally, i.e. pandemic, until there's sustained human-to-human transfer. There's not evidence of human-to-human transfer in a sustained manner right now. Out of 108 cases to date, there are 22 deaths. So if you just rounded it and said that's a 20% fatality rate, that's very high for an influenza virus. From the deaths that have occurred so far, that it is the same pattern that we've seen in other influenza outbreaks, i.e. older patients and younger patients, people with other kind of concomitant disease processes or immune deficiencies of various kinds. The CDC has started to grow the virus in eggs to figure out how the best way is to turn it into a vaccine. It is important to note that the vaccines that have been used for influenza over these last few years do not seem to have any impact at all on the H7N9 in terms of preventing it. We do know that the early indication from the virus testing is that it's not very immunogenic, i.e. it doesn't seem to stimulate a big immune response, and that will have certain implications for the development of the vaccine. It's mostly acting like influenza of the other kind that we're more familiar with. We know that some people have gotten it, have never sought medical care for it, and have gotten over it. We know that people can have mild to moderate illness with it, receive a little bit of care, and do fine. So it has the gamut that it runs in terms of its severity, but with a 20% give or take fatality rate, such as we know it today, that would be higher than what you would expect. For the healthcare community, if they have somebody that comes in at this time of year with an influenza, particularly if it involves travel, it would be recommended to go to the CDC website, look at the guidelines, and to initiate the antiviral treatment as per the recommendations of the CDC. It would be more likely, as in the past, to go to Southeast Asia, Singapore, Indonesia, Australia. But in this day and age of global transportation.
Applications in medicine. While the current risk posed by the Asian H7N9 virus to public health is low, the pandemic potential of this virus is concerning. Influenza viruses are constantly changed, and this virus may acquire the ability to spread easily and steadily from person to person, triggering a global outbreak of this disease. In fact, of the novel influenza A viruses of particular public health concern, Asian lineage H7N9 is rated by the Influenza Risk Assessment Tool as having the greatest potential to cause a pandemic, as well as presenting increased the risk of potential serious public health impact should the virus lead to sustained human-to-human transmission.
about this latest outbreak of bird flu in China. What are people there saying about this latest outbreak of bird flu in China?
Well, I have a chance actually to speak to some government officials, scholars, and also ordinary people in China. And obviously, everybody is concerned. Some are worried, but few actually panic.
And now, Professor, I read over the weekend, and I'm sure you've seen the same information, that there are some signs that perhaps this is a strain of bird flu that could be transmitted through the air. It could be an airborne illness, which would seem to suggest that it has much more propensity, perhaps, to infect people and ultimately, again, not to sound alarmist, but cause an epidemic. What do you know about that quality of the virus thus far?
Well, so far we have 21 cases with 7 deaths. So the case fatality rate is about 33%. So that is still not as high as the death rate for H5N1, even though it developed the capability to be infected in airborne means.
Since it could potentially be airborne, what are neighboring countries doing to possibly prepare for the outbreak, outside of China?
Well, so far, the World Health Organization does not recommend countries to take any particular measures to limit travel. But we have seen some East Asian neighbors of China, like Japan and South Korea, are already instituting thermal scanners to screen people with high temperature at the airports.
Professor, is China, in your opinion, thus far doing an adequate job dealing with this outbreak? And in general, are the Chinese getting better at it the more familiar they become with the way that bird flu tends to spread?
I won't say they have done an adequate job in responding to the outbreak, but I would say compared to 10 years ago during the SARS outbreak, they have done obviously a much better job in terms of reporting the disease situation, in terms of response.
Pros and cons. First, the U.S. government supports international surveillance activity for essential influenza and novel influenza virus, such as the Asian lineage H7N9 virus. Each week in the United States, these public health laboratories routinely test human respiratory specimens for the influenza virus and report these results to the CD. And cons, a sporadic case of Asian H7N9 human infections associated with exposure to poultry are likely to continue in China.
Now, the number of cases of human bird flu infection is rising rapidly in China, citing data from the Chinese Health Commission. A Chinese news portal reported on Friday there were 69 new cases of human infection of the H7N9 strain of avian influenza just last week, and 8 people have died. In January, 79 people in China died of the bird flu strain out of almost 200 new cases of the infection. Now, most of the cases have been found around the country's eastern Yangtze River Delta and the southern Guangdong province, and local experts say they expect the number of human infections to actually rise in the coming days. Meanwhile, the authorities are closing poultry markets in Guangdong to prevent further human infections.
Issue supply in Ecuador. CDC is closely monitoring in Asians H7N9 situations and is working closely with national and international partners. CDC takes routine preparedness measures to counter a pandemic as they are identified, such as the development of vaccines candidate virus.
Chinese and global health authorities are watching a new strain of bird flu very closely indeed. It's called H7N9. And previously, it wasn't believed to be dangerous to humans. But 9 people have contracted the illness in different parts of China, and 3 have died. And authorities in China are at pains to say they're on top of this potential outbreak.
The public is concerned about the information regarding those in close contact with those infected. We are tracing many close contacts, and they are all under strict medical observation. No one who was in contact with the confirmed cases has exhibited symptoms during the quarantine period.
Online and in newspapers, there had been criticism of a possible cover-up of the first cases of this flu. Chinese authorities are certainly very sensitive of those allegations because of SARS 10 years ago and other flu outbreaks when they haven't been very quick to give information. They say that testing kits are being distributed across the country and believe that H7N9 cannot be passed from human to human, but haven't yet ruled that out entirely because more research needs to be done. Certainly a story that needs to be followed very closely. David McKenzie, CNN, Beijing.
In conclusion, CDC has prepared a risk assessment for the Asian H7N9 virus, other routine preparing activity, including the review of new virus sequence to assess their genetic and antigenetic properties as well as their antiviral susceptibility. This information communicates about the current risk assessment process, which determines the actions to be taken. Thank you.